arrive soon enough. Many caregivers are still desperate for the protective gear to keep them safe. Joining us now is Dr. Lipi Roy, an internal medicine physician and an MSNBC Medical Contributor, and Dr. Charlene Babcock, an emergency physician at Ascension St. John Hospital in Detroit. Glad to have you both with us. And Dr. Babcock, let me start with you. Give us your perspective from the front lines of fighting this pandemic. How are the nurses and doctors and others doing, including in terms of supplies?
Well, first of all, I have to tell you that it's not just the doctors and nurses. I think that we have to put a shout out to everybody that comes to work in the hospital. It's incredibly challenging to think about the risk you might be taking. We personally at our hospital still have PPE available. I know that may not be true for all hospitals, but we still have it available. But even with that PPE available, there still is a risk. And not just doctors
I'm sorry, Dr.
and nurses.
Babcock, I'm sorry, I hate to interrupt you. Did I hear you right? Did you say that you don't have any personal protective equipment at all?
No, I'm sorry. I may have misspoke. No, we have plenty of PPE available right now at our institution.
That's the problem with hearing you over a web chat. Thank you for clarifying that. Go ahead.
But it's not just the, I mean, PPE is very important, but you still have a risk when you come to work, even with PPE. And I tell you, it's the doctors, the nurses, it's the respiratory therapists, the transporters, the phlebotomists, and I can't mention everybody there, but it's very important to recognize that these people are coming to work and helping in a very dire situation and taking a risk on themselves. And quite frankly, the hospital wouldn't be able to work like it does if we didn't have all these heroes, not just the doctors and nurses, but all these heroes coming to work. And you can see there, it's something on our front grass as you drive into the hospital to remind everybody that it's so important that they come and help, because the hospital could not function if it wasn't for everybody, including the EMS and police and firefighters too.
Dr. Roy, let me ask you about hydroxychloroquine, this medicine that is being tested as a possible treatment for coronavirus. President Trump has been touting it during his press conferences. He has said repeatedly, what do you have to lose? This is not approved by the FDA to treat COVID-19, although doctors theoretically could prescribe it off-label, and it has been approved for this testing. Dr. Roy, how do you see the prospects for hydroxychloroquine, especially since it's still needed to treat lupus?
Yeah, so let me just drive home a key point that Dr. Babcock made, which was regarding the PPEs. There's a whole spectrum, right, in terms of availability. There are some places that are clearly going to be running out. There are healthcare workers that are reusing it for days. And then even with adequate PPE, these healthcare professionals are really putting themselves at risk just with the sheer volume of patients and with the infectivity of this virus. So I just want to drive home that key point that Dr. Babcock made. Hydroxychloroquine, yeah, so we know that this is actually, it's a safe medication. It's been around for a very long time. The medical community and the research community is very well aware of this medication. The key point, though, for the public to understand is that we do not know the efficacy, if any at all, with hydroxychloroquine in patients with COVID-19. These are the tests and trials that are being done now. But remember, trials take a long, long time for the results to come out. And as you pointed out quite accurately, hydroxychloroquine is used for patients for known indications such as lupus, rheumatoid arthritis, malaria. So when people start using these medications and when doctors and other providers start prescribing it for something that's not approved yet, it's depriving it from other patients who need it. So we need to be really careful. This is not, and in fact, there are no FDA-approved medications at this time to treat COVID-19.
We should also be clear that lupus is not caused by a virus. Lupus is an autoimmune condition. Malaria is a parasitic condition. So trying something that's used for an autoimmune condition on a virus is another frontier in the use of this drug that we really don't have data for yet. Dr. Babcock, before I have to let you go, there's a report out of Politico that I wanted to reference that has to do with states competing against each other for supplies and also the U.S. competing against other countries. You know, a former U.S. official referred to it as Lord of the Flies PPE edition. Developing countries where COVID-19 has yet to fully wreak havoc, writes Politico, are terrified of being left behind in the race for personal protective equipment or PPE and other materials because they cannot match the purchasing power of the U.S. and other wealthy countries. So, Dr. Babcock, what's the solution here? If you could speak on behalf of all other ER doctors directly to Congress, directly to the president, what's the one biggest thing you'd be asking for?
The biggest thing I'd be asking for is to be a little bit more strict about lowering the curve. We right now we are seeing people still gathering, and that doesn't make sense to me, because if we can lower the curve by getting people to do more isolation, then we would not be putting ourselves in such a dire circumstance. I can't tell you if that's going to solve all the problems, but that's something we can do right now and could make a difference, and we're not doing it.
And we should be clear before we let the two of you go that Dr. Anthony Fauci has said that wearing some kind of face covering is not a substitute for social distancing. In every place where the rates have gone down, all of them have involved some form of social distancing. Dr. Charlene Babcock and Dr. Lipi Roy, good talking to you both. Thanks very much. Our trip across America is just getting started on MSNBC. Up next, we will head to Houston, the city with the world's largest medical center. Houston's mayor joins us live next.